smoking might be the hardest thing to do in life. But if you manage to do it, then that's the biggest achievement in life. There's a lot of benefits when someone quits smoking. Firstly, that person will be much more healthier. Not just that, by quitting smoking, you can actually save a lot of money. And trust me, your family will be happy if you quit smoking. Before we proceed on further explanation of the health benefits from quitting smoking, let's look at how smoking harms the cardiovascular system. Firstly, smoking causes atherosclerosis by increasing the formation of plaque in blood vessels. This makes the arteries narrow and become less flexible. This occurs when fat, cholesterol, and other substances in the blood form plaque that builds up the wall of arteries. Next, smoking can also increase the risk for coronary heart disease. Coronary heart disease occurs when arteries that carry blood to the heart muscle are narrowed by plaque or blocked by clots. Chemical in cigarette smoke cause the blood to thicken and form clots inside veins and arteries. Blockage from a clot can lead to a heart attack and sudden death. Besides that, smoking can also increase the risk for strokes. Deaths from strokes are more likely among smokers than among former smokers or people who have never smoked. Last but not least, smoking is a known cause of early damage to the abdominal aorta, which can lead to an aneurysm. A ruptured abdominal aortic aneurysm is life-threatening. Almost all deaths from abdominal aortic aneurysms are caused by smoking. Now, let us look at cardiovascular health benefits of quitting smoking. Quitting smoking will help in reducing risk of disease and death from cardiovascular disease. It can also help in reducing markers of inflammation and hypercoagulability. Other than that, smoking cessation can also lower the risk of disease and death from stroke. It can also decrease the risk of abdominal aortic aneurysm. It can also shorten the development of subclinical atherosclerosis and slows its progression over time. And last but not least, quitting smoking may lower the risk of coronary heart disease.
Let us talk about the respiratory health benefits of quitting smoking. Before that, we need to know that smoking affects the lungs. Smoking irritates the trachea and larynx, decreases lung function and causes breathlessness, impairs the lung scale system that leads to the build-up of poisonous substances, which results in lung irritation and damage, increases risk of lung infection and symptoms such as coughing and wheezing, as well as causing permanent damage to the air sacs of the lungs. Furthermore, smoking is one of the major causes of respiratory diseases. For example, smokers are more prone to chronic obstructive pulmonary disease or COPD, such as emphysema and chronic bronchitis. Besides, they have an increased risk of lung cancer and asthma attack in patients with asthma. So, what are the respiratory health benefits if a smoker stops smoking? Quitting smoking can reverse some of the lung damage, reduce the risk of developing COPD and decrease COPD mortality rates, besides slowing the progression of COPD and improving pulmonary function over time in COPD patients. Moreover, quitting smoking is shown to be beneficial in reducing respiratory symptoms such as coughing, sputum production, and wheezing. It also helps in reducing respiratory infections like bronchitis and pneumonia, and it may improve lung function, reduce symptoms, and improve treatment outcomes in asthma patients.
One of the most certain benefits of quitting smoking is the cancer-related health benefits. It is almost certain that smoking will increase your risk of getting cancer, especially lung cancer. Do you know that one single cigarette that is about 6 to 7 cm long consists of more than 7,357 of different chemical compounds inside of it? This is an estimated number. There could be more of them. Out of these 7,000 plus compounds, 70 out of them are confirmed to be carcinogenic, which means that will cause you to get cancer. Furthermore, some studies are still ongoing, and many more of these chemical compounds are suspected to have carcinogenic effects too. So here, I'm going to show you some of these carcinogenic compounds found in the cigarettes. First of all is the N-nitrosamines, a very strong genotoxic carcinogen to cause damage and mutation and will produce cancer in diverse organs such as lung, brain, liver, etc. Aromatic amines. It contaminates the air and is proven to cause bladder cancer in smokers. Formaldehyde, common fixative used in the laboratory to cause leukemia and also other rare cancers in nasal cavity and nasopharynx. Polyaromatic hydrocarbons, another carcinogen found which increases the risk of lung cancer, skin cancer, and so on. There are more of them not listed here, such as chemical used in the insecticide, rat poison, noise polish remover, and most of them are either confirmed or suspected carcinogenic. So, generally, smoking highly increases your chances of getting a cancer, whether it is stomach cancer, liver cancer, mouth cancer, colon cancer, and most certainly lung cancer, or just any other cancer. Centers for Disease Control and Prevention had once stated statistically that in the United States, cigarette smoking is linked to about 80 to 90% of lung cancer deaths. Hence, are you aware of how exposed are you to danger if you smoke consistently? Since we already know that smoking causes cancer, what action can we take? The best answer is to quit smoking. Quitting smoking is one of the most important actions for people who smoke. It can reduce their exposure to the carcinogens inside the cigarette smoke, hence decrease the probability of getting a cancer. It is proven that quitting smoking reduces the risk of 12 different cancers, including mouth and throat, esophagus, kidney, voice box, cancer of the lung, stomach, colon and rectum, bladder, cervix, pancreas, liver, and acute myeloid leukemia.
Let us proceed to the reproductive health benefits of quitting smoking. Reproductive system consists of tissue, glands, and organs involved in producing children. Smoking harms the reproductive health of men and women. Male smokers can suffer of increased number of abnormal sperm. The oddly shaped sperm may not swim well enough to get to the egg and may not be able to fertilize an egg. Next is low sperm concentration and sperm mortality. Sperm concentration is referred to the number of sperm found in a measured quantity of semen. In terms of the sperm motility, it refers to the swimming capabilities of the sperm. If the sperm cannot swim properly, they may have trouble reaching the egg and fertilizing it. Next is erectile dysfunction. Erectile dysfunction refers to the inability to get and keep an erection firm enough for sex. Lastly, smoking can damage the DNA, which it leads to problems with fertilization, embryo development, embryo implantation, and increased miscarriage rates. Male smokers may also have abnormal hormone levels, which can affect fertility. Women who smoke have more difficulty becoming pregnant and have a higher risk of never becoming pregnant. Other than that, smoking during pregnancy can cause tissue damage in the unborn baby, particularly in the lung and brain. Lastly, carbon monoxide in tobacco can keep the developing baby from getting enough oxygen. Tobacco smoke also contains other chemicals that can harm unborn babies. As soon as the man stops smoking, his sperm will become healthier. 3 months is needed for sperm maturation. Men who quit at least 3 months before conception will have the healthier sperm with a greater chance of fertilizing an egg and creating a healthy baby. Quitting smoking is one of the most important actions women who smoke can take for a healthy pregnancy and a healthy baby. Quitting before pregnancy or early in pregnancy reduces the risk for a small for gestational age baby, which means the baby are smaller than other babies of the same gestational age. Next, quitting during pregnancy reduces the risk of delivering a low birth weight baby, which refer to the baby who will weigh less than 2.5 kg. And then quitting early in pregnancies reduces the adverse effect of smoking on fetal growth. Lastly, quitting before pregnancy or early in pregnancy may reduce the risk of preterm delivery, which are premature birth, which the birth of a baby at fewer than 37-week gestational age. Quitting smoking can be hard, but it is one of the best ways a woman can protect herself and her baby health.
The health benefits of quitting smoking over time. After you smoke your last cigarette, your body begins a series of positive changes that continue for years. In minutes, heart rate drops. In 24 hours, nicotine level in the blood drops to 0. In 2 days, carbon monoxide level in the blood drops to normal. In 1 to 12 months, coughing and shortness of breath decrease. In 1 to 2 years, risk of heart attack drops sharply. Between 3 to 6 years, added risk of coronary heart disease drop by half. Next, in 5 to 10 years, risk of stroke decreases. In 15 years, the risk of coronary heart disease drops to close non-smoker. As the take-home message, quitting smoking can improve health that can increase life expectancy. Last but not least, quitting smoking also can reduce the risk of reproductive health disease, cardiovascular disease, and cancers.